Hello, I'm Dr. Chet. Today I'm going to guide you through vaginal dilation, or as many of my patients like to call it, dilating. We go through it together, step by step. Before we begin, let's make sure you have everything ready. You need your set of dilators, a water-based lubricant, a mirror, gloves, a bed pad or protective sheet, and some tissue or baby wipe. Once you're ready, get into a comfortable semi-reclined position. Bend both knees and let your legs relax apart. During the first 3 months after surgery, try not to spread your legs wider than about 60 degrees, as this may place unnecessary tension on your healing incision. The goal of vaginal dilation is to maintain the depth of your vagina while avoiding injury to the delicate tissue inside during insertion. There are two keys to successful dilation. The first is being consistent. The second is using lubricant correctly. Always use a water-based lubricant and don't be afraid to use plenty of it, especially during the first 6 months after surgery. The more lubricant you use, the easier dilation becomes. It reduces friction, which is the most common cause of small tears, soreness, or bleeding from granulation tissue. Let's start with the lubricant. Before inserting the dilator, we want to get the lubricant inside the vaginal canal. Here's a simple tip. First, use your index finger to spread lubricant all around the vaginal opening. Then scoop up a little more lubricant with your finger and gently push it into the vagina as far as your finger comfortably reaches. This helps coat and protect the delicate junction between the vaginal opening and the new vaginal lining, which is one of the most sensitive areas during healing. Once that's done, be ready to insert the dilator. In the beginning, I recommend using a mirror so you can clearly see the vaginal opening. Place the tip of the dilator at the opening and gently begin inserting it. The direction should be slightly downward, just beneath the urethra. If you feel resistant, don't force it. Pause. Apply a little more lubricant. Relax and try again. Once the dilator passes through the vaginal opening, slowly advance it until it reaches the full depth of your vagina. When the tip reaches the deepest point, maintain gentle pressure so the dilator doesn't gradually slide back out. Hold it there for the recommended amount of time. When you finish, slowly and gently remove the dilator. If you're moving up to the next dilator size, remember to apply fresh lubricant every time, both to the dilator and around the vaginal opening. When you first start using a larger size, it's completely normal if it doesn't go in all the way. Don't force it. Increase the depth little by little. For some people, it takes several days before the larger dilator reaches the same depth as the smaller one. That's perfectly normal. Your body will gradually adapt with time. Before we finish, I like to leave you with 3 simple tips for success. First, don't rush, don't tense up, and don't force it. Second, stay relaxed, take slow, deep breaths, and focus on what you're doing. And finally, be consistent. With regular practice, dilation will become easier, more comfortable, and eventually just a normal part of your daily routine. If you have any questions or experience any problems during your recovery, please don't hesitate to contact me or my team, all of us at WIH International Hospital, always here to support you.